So you understand about how to diagnose soft tissue dysfunction, you understand about the appliances. The next step is starting to talk to parents and children about why they have a growth and development problem. So this is the patient education section. This is the key section to allow you to start treating patients. Because if you explain to any parent that there's something wrong with their child's growth and development, every parent will be interested. And so it's a matter of being able to confidently explain soft tissue dysfunction, and we have a CD that allows you very easy to do this, and also your staff. And I'll run through that in this presentation. So the majority of children have some sort of malocclusion developing. So at any age, you should be able to recognise this, and you need to be able to explain that to the parents. That relates to millions of children. There's no shortage of patients. All you need to do is be able to communicate correctly with the parents, and you'll have endless numbers of patients. Of course, then you have to learn how to use the appliance system to correct these habits. So that's millions of kids in every country. So let's look at how we present this to the patient. Now, the first thing, you, the doctor, you have to understand about the appliance systems. If you don't know about the appliance systems and can't explain it properly to the parents, this is never going to work. Then you've got to get your staff to be able to communicate well with both the parents and the children. Parent education is really important. We'll show you how to do that. Down to the child's level is very important as well. You must establish treatment goals. What are you trying to achieve? It's not just about straightening teeth, and you have to get compliance, otherwise this doesn't work. There are biological limitations. You can't make every child look like a movie star, and you have to make sure that's explained well to the parents. Financial education. How do we charge for this? How do we make it financially viable in the practice? So you, the doctor, understand about correcting myofunctional habits. The basic trainer system gets the tongue up into the maxilla. You have to know this, and you have to be able to use the appliances effectively. So it's all about getting the tongue up into the maxilla. So good appliance knowledge is essential. Understanding soft tissue dysfunction. What are we treating? Treating the muscles, not the teeth. The teeth come along for the ride. Understand about the appliance systems, both the basic and advanced. If you're just starting on this, start with the basic system, but be aware that until you move on to the more advanced appliances, you're limiting the scale that you can introduce this into your practice. Learn about using the arch expansion appliances, which allows you to apply this system to virtually every patient with a malocclusion. Staff education. This is very important. Pretty much 90% of this can be delegated to your staff members. You do it first, show them how to do it, and then the staff members will be able to do a lot of the patient education for you.
Do you want to come in front of this?
And they should at least be able to do this. The most important thing, as we show you later, is be able to communicate directly with the children. A lot of doctors can't do this. Your staff are probably better at it than you are, but they have to be trained how to get the children to be motivated to use the appliance systems. Then you don't waste your time, and the whole system works smoothly. So staff education is important because they can do most of the re-education themselves.
Okay, so when you swallow,
The great thing about this system is that although you're the doctor, you're driving the treatment system, a lot of it is really performed away from the dental chair. This is why we come to the MRC Clinic's layout system. You need an extra space like we have our activities area, because you don't need these patients sitting in a dental chair. Here we have our issue of the appliance. You can see we make it a bit of a fun game sort of thing.
That's better. So
and here I'll let
tongue tag to always be sitting on the top. So
Varney
put yours in. So
explain to you how she presents it to the patient.
That's better. So have a look. Just open for me. Bite together. Bite nice and hard. Do you have a look in the camera and show them how your trainer looks? There you go. Okay, that's good. just going to play a video for you to watch. So it's just going to tell you how you have to wear your trainer and what it's all about, and then we're going to start on some activities, okay?
We're going to learn about something really important for your teeth and face. They're called the MRC trainer activities. And they're going to be...
Alright guys. Do you have any questions after seeing that at all, Hamish or Eliza? No? Do you guys want to come in front of these mirrors and we'll go through the activities now? What do you reckon? Now if you put your lips together with your tongue in that spot, that's better. So that's where we want your tongue to be sitting all the time. So you put your tongue on that spot in the roof of your mouth, that's good, with your lips together, and we want you to push your tongue back and up against the roof of your mouth rather than down and forward. So we shouldn't see any of this move at all when you swallow. All right, and the last one is always remembering to breathe through your nose, okay?
I'm doing right now.
That's good. So you want to have your lips together over the trainer? That's good. So I'm going to give you these trainer activities books. That's Hamish's and this is Eliza's. I'll just show you how it works. So maybe Eliza might have to help Hamish with this. So in the front it pretty much tells you how you wear your trainer, and then all the activities are in here. So we're working on group 1 activities, okay? Okay? And at the very back is the spot where I want you to write down when you wear your trainer during the day, when you do your activities. And if you wear it overnight, just write down whether it stays in all through the night or not. So maybe you can put a tick there if it does and a cross if it doesn't. So do you know how long you're going to wear your trainer for? For 1 hour during the day, and then you're going to put it in when you go to sleep as well, okay? Can you do that for us? Good. Okay, so if you just take a seat on here and Hamish can watch and see what you're doing. So you just want to type in your username. So if you go to trainerkids.com, this is the screen that will come up. Okay, so this is the video that we just went through, and it will pretty much show you exactly what it just showed you, okay? So if you ever forget what it was all about, you can have a look at it. This is where all the activities are. So we're working on group 1. So can you see the house numbers? There's 1, 2, and 3. We want to concentrate on group 1. So if you press on one of the people, you can even touch the screen because it's a touch screen one. So if you just click on just like that, and it'll go into the activity and the video. Yeah, so that's the breathing awareness activity. Okay, so when you go home, maybe you can have a play around with it.
Parent education is important. We have an educational CD that allows you to explain everything to the patient in very simple terms. This is the MyBrace patient education CD.
I'm Jackie, and today we're going to learn about...
You'll see it goes through very logically. You just press next, and all the information you need to present to the parents is involved in this CD. We explain about mouth open posture, reverse swallowing, what normal growth and development is, and how the jaws grow downwards and forwards, and how incorrect development restricts the development of the face. Then we can click on any age group and it gives us basically the treatment. There's a text prompt here, so your staff can very easily be trained how to do it. And we have a mybrace.com website which allows the patients and parents go home and get further information. Child's education. We're right down to the child's level. It's all about the children and getting them to change their myofunctional habits. We say 50% as the doctor and their staff, 50% is changing the children's myofunctional habits. This is not just giving them a trainer and say, go away, come back, and your teeth will all be straight. This is very much interactive with the children. Very important to get their cooperation, get down to the children's level. Educating the children, even a 5-year-old can understand that if they're breathing through the mouth using our very good 2Ds, all the bacteria are going straight into their throats. When you breathe through the nose, it filters the air, and then you'll get less infection. And the other thing that you'll get is straight teeth and good facial development. So it's important to explain these things directly to the children about the effects of mouth breathing and the correct function of nose breathing, and this is why they're using a trainer. If they don't understand why they're using a trainer, the treatment doesn't work, and that's where you get really good compliance. So trainer goes in place. I showed you this before, tongue on the spot. This has to be trained down to the children's level. Again, same thing. What's the correct swallow? So every time the child comes in, we show in this animation, that's where your tongue should be, and you'd be surprised how quickly, when the children are watching a video like this, they really understand what the correct tongue position is. Very important treatment goals. What are we trying to achieve here? This has to be explained fully to the patient and the parent. We want the child to breathe through the nose. Number one, not breathing through the nose, treatment's not going to work. Lips together at rest, correct tongue position. When you swallow, we don't want to see those lips move. That's what you have to practice. We want the best facial development that we can get, that you're genetically determined to have. We want class 1 occlusion, and we explain that as a correct bite. Number 7 is straight teeth. So our primary goal is not like an orthodontic practice. Our primary goal is not to straighten the teeth, although the teeth end up straight, and we can straighten them with anything. If we get 1 to 6 right, 7 really nearly always follows. And we prefer not to use retainers. Can't always achieve that, but we prefer not to need retainers. Okay, what are the actions? What does a child have to do? This is really important to explain this. You have to wear the trainer at least once a day, plus overnight while sleeping. If it's the MyoBrace system, we say 1 to 2 hours. Regular use every day is essential. If we don't use it every day, it's not going to work. We want the trainer and MyoBrace to stay in at night. That's our first goal. We have to do everything to achieve that. And we need to do one activity at least once a day. Learn how to swallow correctly, tongue position, all those basic trainer activities, they should practice at least once a day. And it's not negotiable just wearing an appliance and then having the mouth open all the time. So you have to keep your mouth closed when you're not speaking or eating. Tongue should be resting into the maxilla pretty much all the time. And they've got to come and see you regularly. We have to monitor progress. No good they come and 1 month and then 2 months later they turn up again. We have to make sure this is regular, and we have to make sure that we know when to change appliances to something different. And we can't allow the jaws to get good growth and development unless we have a good nutritional diet. And so we look at their diet, including look at what is causing their allergies and chronic infection. And we want a hard diet, but we also want a nutritious diet. Compliance, once you get all these in place, compliance is really not an issue. But compliance is everything. If you get good compliance, you get good results. And I said, this is what compliance is all about, and explaining exactly what the child needs to achieve. And as I said, 50% of it is what the child motivates themselves to do. So in our practice, we have a large activities area. We can explain this to many children simultaneously. You can see that the parents need to be involved, but they're always in the background. It's always direct to the child. Biological limitations. Understand, this is why we bring Western Price in, understand that many of these children aren't going to react as favourable as we want to. If you read Western Price's book, we know that a lot of these children are nutritionally deficient and have been through a number of generations. So some react really well, some react much more slowly. Diet is a big factor, and I say to parents, the worst thing you can feed a child in the morning is milk and a sugary cereal, and you want to eliminate the things that we know are bad about the diet, because that makes a great effect on treatment. This is how we do it. We're not making this up. This is how we have developed the MRC clinic system. So any of you want to come and see our practice,
300 years ago, almost nobody had crooked teeth.
come over to Australia.
Almost everybody has crooked teeth. And what we try and do is help children to grow straighter teeth while they're growing up. It's It's an innovative way of delivering dental services. If you're used to sitting in a little room 3 by 4 metres with a dental chair and a light shining in your face, you're going to be a bit disappointed. That's not the way we deliver orthodontic services today. This is going to be the training centre in Australia where doctors from around the world can come and learn how to use these techniques.
I'm absolutely delighted to be here this morning and welcome MRC to this area. I'm equally intrigued, as I'm sure you all are, about their ability to straighten teeth without braces. And as a girl who grew up in the 70s with a mouthful of metal, I've already been up to make inquiries about an appointment because my teeth have all moved back to their original location. So it's great to see them coming into this area. I think those of you who live in this area like me would have recognised that we're growing so rapidly and with lots of families and young children, so it will be a very welcome service in our community. It's now my great pleasure to officially open MRC Clinic at Upper Coomera.